I'll now call to order the regular meeting of the Potter Valley Healthcare District Hospital Corporation. Before we start, I'd like to make a motion to excuse Director Pimentel's absence of tonight's meeting. Can I get a second for that? Second.
Director Gallagher?
Yes.
Director Johnson?
Yes.
Director Fox? Yes. Chair Higgins?
Yes. Just as a reminder, as you know, these meetings are publicly broadcast via Zoom. Even in the case that the public is not physically present, please consider that participants may be virtual, and that the meeting is recorded and posted for public viewing. We have nothing to report from closed session. Sorry, I have to do a roll call, please.
All right, Director Gallagher?
Yes.
Director Johnson?
Yes.
Director Fox? Here. Chair Higgins?
Here. Are there any agenda modifications from staff for consideration tonight? Now I'll ask for public comment on matters not on tonight's agenda. Rosie, any raised hands on that?
No hands on line.
Anyone in the public wishing to speak on items not on the agenda? Seeing none, I'll close the public comment. Any comments from board members at this time? Okay, I'll close down the comment session for board members and move on to the consent calendar. Rosie, if you can, give us a rundown of the 6 items on the consent calendar.
The first item is the minutes approval from June 26th for the regular meeting and July 31st for the regular meeting as well. The second item are the policies and the policy summary approval from August 2024. The third item is the Potter Valley Healthcare District and Potter Valley Healthcare District Hospital Corporation 2023 updated consolidated audit report. Fourth item would be an agreement for on-call services. The fifth item is an agreement for Century 7 and Simplify 797 software. And the sixth item is the Potter Valley Healthcare District Hospital Corporation resolution authorizing execution of the bond certificates.
Before I open it up for public comment, are there any questions on any of the items on the consent calendar? Okay, seeing none, I'll open it up to public comment. Let's see any raised hands online. Anyone wishing to speak on the consent items? Seeing none, I'll close down the public comment session and entertain a motion.
Move approval consent.
Second. Director Gallagher.
Yes.
Director Johnson.
Yes.
Director Cox. Yes. Chair Higgins.
Yes. Okay, we'll move on to item number 7. It's the medical executive committee for August report for August 2024. And we received this report in closed session. Is there any additional questions before we open up to a public comment?
It's not a question, it's a comment.
Please.
She's not here. In the report from Quality Patient Safety, there was a thought about extending the meeting to be an hour-and-a-half meeting. I would support that idea as being a useful thing to do. That's my comment about it.
Noted. Thank you. Thank you. Any other comments or questions from the board before we go? Okay, I'll open it up to public comment. I don't see any raised hands online. I don't see any raised hands person, and I'll close down the public comment. And I'll entertain a motion for item number 7.
So moved.
Second. Thank you. Director Gallagher.
Yes.
Director Johnson.
Yes.
Cox. Yes. Chair Higgins.
Yes. We'll move on to item number 8. It's the Chief Executive Officer report. See, whenever you're ready. Thank you.
We do have some items to celebrate today with respect to our leadership updates. So reminder about our strategic priorities, and I'm going to bring you through the latest on our dashboard. I know you know the color scheme by now. There, just as a reference. So we were able to get rid of those reds that we had on the dashboard in last month. So that's really great news. And in addition to that, for the first time this year, certainly, and I don't know about, did you have something?
Sorry, we just said.
Before I get done.
Yeah.
But don't advance quite yet.
Okay. Should I go back?
Okay, good.
Now the thing's not working.
Oh, not right.
Yeah, okay, great. So for the first time, we have achieved green, our target goal for the year for our patient experience. So we've exceeded the 65th percentile for the year to date. So this is patients who are here and discharged during the year 2024. 163 of those surveys received back so far. 74.2% of them have given us a 9 or 10. This was in the mid to high 60% earlier in the year. So this is a really tremendous improvement. Moving that number by a couple percentage points is typically statistically significant. So to move it 6 or 7 percentage points in a matter of 7 months is really pretty tremendous. And then our hospital acquired conditions, again, we're looking at this now that we're into month 7 of our dashboard. We have a significant enough sample size for 2024 that you'll notice that none of these metrics are rolling 12 months in. Now either year to date or annualized for the first 7 months, because we've got a significant sample size for 2024. So we're at 21 hospital acquired conditions on an annualized basis. So there's, and I'm going to go through those. And so this is the monthly look at our hospital acquired conditions so far in 2024. And then you can see the 2023 comparison on the left. Some really great improvements in falls with injury and pressure injuries this year compared to last year. And now we've gone 4 months without one of each of those. C. diff was definitely a problem last year. It started off a problem the first few months of this year, but we've gone a couple months without one. That's tremendous. Central line associated bloodstream infection is CLABSI. And so we had one of those last year. So far done this year. And then CAUTI, which is our catheter-associated urinary tract infections and surgical site infections. We were feeling pretty good about those for the first 6 months, first 5 or 6 months. And then they've started to creep back into our lexicon again. So we're having to go back and look at why those happened and how we can make sure that those don't become another trend that we have to look at. But so far, with just 12 in the year, we're definitely well ahead of our pace from last year. And you can see that our baseline target for this year was 32. We did find a few more from 2023. So 2023 was actually 37. Looking at our criteria, we had originally thought it was 32, but it was 37. We're not going to change the targets on the dashboard. Baseline is still 32. Patient experience. This is just sort of one to just squint and see the trend, right? You can see the trend going up and to the right tremendously over the last 4 of the last 5 months are at best practice, which is blue, and that's better than the 75th percentile. You can see the sample on the very bottom row, if you can see that. The sample size for the last month is just 5. Because it's as we receive them in, so that was not too statistically significant, but still a really great trend. And then this is going back to 2019, the quarterly trend for this particular measure on HCAHPS. So you can see the just a couple of quarters in the last 4 years that we're at baseline, and we've now got 2 quarters at baseline and then 1 quarter so far that's at best practice. So really amazing job by the team. Kim is here in our audience. She orients everybody to all the new employees during new employee orientation and does an HCAHPS presentation. And so I know that that is a huge help for this as we orient our new people to the importance of all of this. And Phyllis has done a tremendous job of getting standards of practice in nursing back together, which definitely helps this. And Matko has been rounding with his CVS team and lab team and all the others who impact this on a non-nursing side. Really it's pretty awesome story here so far. So hopefully we can keep it going. Patient served had dipped in just barely into the red last month, and now it's back to green. So just a little bit ahead of our budgeted target goal for this year in terms of our outpatient volumes. We're still right around target and baseline for transfers to another facility, and there was a request for a little bit more data on this one. So here are the data for transfers out of the emergency department. The sort of dark greenish teal is the total number of actual transfers out of the emergency department. And then for the last 3 months, if you back out the transfers that were due to the pediatric psych program that we have, those are patients who would have gone to Dominican for treatment and then transfer because they're in a pediatric psychiatric crisis. They're now coming to us. So if you back those out, you can see we had 5 of those in May, 5 of those in June, 15 of those in July. As that number keeps going up. But still, even with that, we're seeing more transfers. We're just seeing a higher volume of patients, and we're seeing more patients who need higher levels of care. So the team is doing a really good job. Staff retention, this number has come up again. This is annualized, so we're not looking at 23 anymore. 23 was 76% so far for this year. Year to date, annualized, we're at 79%. And I wanted to give you a sense of where that sort of how that ranks among other healthcare institutions. And so we were able to pull from the NSI Nursing Solutions 2024 retention and nurse staffing report for hospitals. 2023, we were at 76%. This year, we're at 79%. The national median is 78%. And the 75th percentile is 81%. So we're going to continue to strive to get back up to some of those best practice levels, but going from below median to better than median is a nice little trend. And in that report, they said that most hospitals are, they have goals or trying to improve their percentage by 1 to 3 percentage points, and we've got 3 so far, so that's pretty good. Financials, I know obviously Julie will go through this in more detail. We did have a loss in July, and so we're at a $1.8 million loss for the combined hospital and district through year to date through July. And I did put a little bullet point on the bottom underneath that. At this point, last year we were at a $9 million loss. So 1.8 million. It's still not where we want to be. It's significantly better than budget. But it's quite a bit better than last year. Julie will go into some more details there. And then finally, a nice little celebration. We did have a team in the Health Trust's Rally in the Valley softball tournament. And not only did we submit a team, but we won the whole thing.
Oh, wow.
So we brought the trophy back. Matt was gonna build us a trophy case. And we're gonna keep adding some more trophies to that trophy case. But that was really exciting. We got to raise, altogether, we raised over $3,000 for Luna y Sol Familia Center that the Health Trust was raising money for. And we played 5 games in one day. And I needed to sit in a bucket of ice water afterwards, but it was really I will hand over the baton to Matt and Phyllis. Yeah.
So starting with the physicians, our radiology group, Advanced Vascular and Interventional Specialists, has issued a termination notice for their services. That's going to be effective December 18th. So we'll be working with groups to get proposals in hand and see what we can do. They, along with their termination notice, they also issued a proposal because the current contract wasn't adequate for them. So they've issued a termination and a proposal on behalf of others that we've been working with as well. On the facilities front, we're working on efficiency projects and opportunities to improve efficiencies in the building. We've met with American Energy Partners to go over LED and HVAC improvements that will reduce our overall usage of power, which is a goal. This will go hand in hand with the solar that we're doing. So decreasing energy usage, increasing solar generation, reduce our utility bills significantly. Our disaster preparedness team is always working hard, and they have a tabletop exercise that they'll be conducting tomorrow, getting everybody in tune with our processes and working through that. Jennifer's in the audience, and I want to thank her and her team. 340B is live in the outpatient pharmacy. It is active right now. So we'll be continuing to roll that out through the facility, but we've signed up a few folks already, and we'll just continue to generate those savings. So thank you to Jen and her team for that. Nourish is a very popular attraction for the facility, and Stanford Children's Office of Child Health Equity was on site to visit Nourish on Monday and to learn about the process and learn about our partnership with Second Harvest and how we developed that. So they were very complimentary of what they saw, and it's nice having a facility like Stanford and their team coming here to look at something versus us always try to emulate what they're doing. So they're very excited and eager to replicate that within their organization. And then I'll be presenting foundation updates at these meetings as well. And so I wanted to talk about a couple of things. Foundation has launched their newsletter, so you may be receiving those already. Together in Health, it went out this week, and it's also included in the board packet. That'll be about a quarterly issuance. And the foundation, I want to thank them as well for facilitating our hospital leadership retreat. Thanks to a special donor, we're able to conduct a retreat for the hospital leadership team. We have not had a hospital leadership retreat in probably 10 years or so. So this is another huge step, getting back on track with what we're trying to achieve here as an organization. And then on your table, and you probably received these already, but the foundation's gala event is on September 21st. This Saturday, they'll be conducting sales at the Cabrillo Farmers Market and publicizing the event, selling tickets. They've had great success with sponsors thus far. Companies like Driscoll, BBK, Sutter, Second Harvest Food Bank. Our own hospital medical staff is sponsoring, along with Salud para la Gente, Kaiser, Al Family Properties, and Batuity are some of the donors that are contributing already. The foundation strategic planning event will be held in November. The date's still to be determined, but they're working with the facilitator to get that going. And Patricia Gardner, who's a consultant, one of the consultants for the foundation, is conducting interviews already to gather information from stakeholders that they can use during that planning event. And then a couple of things that we've received over the last few months on the grant front. We received a $88,000 grant for balloon pump for the cath lab, $45,000 for Irby machines, which are in our GI labs. The OB ultrasound, Dignity Foundation donated $45,000 to our foundation for the purchase of an OB ultrasound. And education equipment and simulation mannequins that the foundation purchased for us, $16,000. Happy to take any questions. Yes.
Is the radiology group the on-site group, or this is the tele group that's given notice?
They are on site sometimes and tele, sometimes it's we only have one group.
Okay,
So they contract with StatRad for after hours tele coverage.
and they've been here for 6 months or 8 months?
April 15th was their start.
Thank you.
Any other questions for the nursing?
Good evening, everybody. So a few things. I wanted to start with some accolades. You hear me. So I wanted to let you know that our CCU team, along with Dr. Clay Angel, who you all know, went to the National Delirium Conference in Sacramento and presented, and were very well received. And it's just really wonderful to see our nursing teams come together and use evidence-based medicine to deliver excellent care in the CCUs. To share that with all of you. Our perinatal services unit, led by our friend Kim over there, received recognition from CDPH, who the California Department of Public Health doesn't give out a lot of accolades, and they give an accolade to our OB unit because of the great documentation that they do. I wanted to let you know that we have welcomed this last week Cabrillo College nursing students onto our campus. We are so excited because bringing nursing students onto nursing units gets a lot of energy generated. You know, people can get back in touch with what their passion is, what their why is. So really excited to have nursing students back in the hospital. Our ED team received a peer recognition from the Dominican Hospital ED regarding a trauma patient that came in. And our team did a wonderful job delivering the standard of care and really did a wonderful job of stabilizing that patient, doing all the things that patient needed, and then doing a transfer to higher level of care. So, you know, we are not a trauma center, but you never know what's going to roll in the doors. And our team did an excellent job of taking great care of that patient, and a physician there reached out to let us know personally. So that's something you just don't see every day. So I wanted to share that with you. We have received recognition in excellence in stroke care delivery. As Steve mentioned, our Press Ganey scores are continuing to go up. There's a lot of work going on there. And wanted to also let you know, we have welcomed Susan Casperson as the new Adult Services Director. She started this last week. So if you happen to see her in the hall, welcome her. One thing I'm happy to report is that we are revitalizing the Watsonville Community Hospital volunteers and activating them so that they are more ingrained in our daily work, and they're super excited to get back to rounding on nursing units and rounding in waiting rooms. And one important thing I wanted to make sure all of you are aware is that we have had to put a hold on pediatric admissions for right now. As you may be aware, pediatric patients are admitted to our med-surg floor. Finding a combination nurse that takes care of both adults and pediatrics is a very difficult thing to find. So we do not have adequate staffing on night shift right now to admit peds. So we have had to stop those admissions. We are tracking how many additional transfers, and this has been about 3 weeks, and we've transferred 6 patients. So 6 pediatric patients. Primarily, these are patients who would be admitted for surgery. Most often it's appendectomies. So the good news is, working with our educator, Kirsten, we are putting together a plan so that we can admit patients 14 years of age and older onto the med-surg unit, because by Title 22, those can be treated as on an adult unit, so that we can at least start to put our foot back into that environment. In the meantime, we're continuing to recruit and working on long-term planning to make sure that we have a sustainable pediatric staffing model. And that's it for me. Happy to answer questions.
Any questions?
So sorry, yeah, I missed something. Phyllis,
Yeah.
the award that came to the ED team, it was a kudos from Dominicans ER?
Yeah,
And they were the receiving hospital?
they were the receiving hospital for higher level care transfer.
Are they a trauma center or no? They just. had
No,
the-
but that,
Okay,
the care that the patient needed, that was the closest hospital that delivered the type of care that the patient needed.
thank you.
Thank you. I do need to open it up to public comment. Any questions overall that any of the 3 presentations or updates? Seeing none, I'll open up the public comment. Any raised hands online? Please, please. Up here at the podium.
Anything?
It's just regarding the 3 updates that were up online. We'll have for items not on the agenda, upcoming at the beginning of the healthcare district meeting.
Is that,
It'll be an opportunity and,
that mean, I cannot do it.
we'll have an opportunity, Antonio, in a few moments when we start the next agenda. So I'll wave at you. Yeah, thank you. Seeing no other public comment for this item, I'll go ahead and close it down and move on to item number 9, the CFO report. Julie, whenever you're ready to go, we're ready.
All right, thank you. As soon as Rosie brings up the presentation, I'm ready. Can everybody hear me okay?
Yep, yeah.
Great. All right, let's go to the first slide.
Right.
Okay, so Steve did give you a little preview of the year to date, and I'm going to talk first about month to date and then year to date. And one thing that Steve did save for me to tell you is that the results you saw in July with the $1.8 million year to date loss, we actually discovered an error in our bad debt posting that we discovered after we had closed the books. So we made a determination not to reopen the books and repost July, but rather to fix it in August, since we're just a few weeks away from closing out August. So the good news is that will bring us to a more favorable position. It's about a $975,000 improvement on the bad debt line, which is kind of buried in this piece, but I just wanted to kind of give you a heads up, because what it means is, where you see here for the month to date us losing about 640,000, it's really going to mean that we made about 330,000 in favorable EBITDA, and it will put us pretty close to a break even net net income at the very bottom line. The normal story here was that our net operating revenue was running short from what our total operating expense was. That has been the story that we've seen most of the year because of lower volumes. And while volumes picked up a little bit from June, when I go through some of the volumes, you'll still see that in some cases we're still shy to what we've done in other months. Next slide. So here is the year to date, as stated in July. So this matches what Steve showed you. But again, with a $975,000 improvement, we're really going to be at, high $800,000 loss instead of a $1.8 million loss. So definitely doing better than budget, doing better than last year. And we will continue to work on that. Next slide. So here was a new slide I wanted to put in just to show you kind of on a rolling 13-month, the blue bars being total expenses and the green line being net revenue, that, in the last 3 months, we have had that situation where the net revenue has come in less than expense. And that is the challenge that we're faced often when we have the lower volumes that we've been experiencing. And you can see, last summer we had a few of those months as well, and then things picked up a little bit, but it still can be volatile for us. It just goes to show how much volume really drives how our month is going to look. Next slide. Here's what admissions have done over the last 13 months. And we've been talking about the fact that admissions have been on a kind of declining trend line, but that also a good portion of that is due to the fact that we've improved our recognition of when a patient is really just observation status and should not be admitted to inpatient. And since we don't get paid if they're admitted inappropriately, it's a good thing that we've identified it and corrected it. Next slide. So this shows you with the observation cases being added on top of the admissions. So the blue bars being admissions, the green being the observation cases, and then the little red triangle at the top with the numbers is actually the combined observation plus admissions. And, January, actually, somehow we got a little bit off in I think in our labeling on the bottom. That was probably me making some last minute changes. This is really July to July, but my labels, I didn't catch that I messed them up. You can see that the two far ends, 363 on the left side and 356 on the right side, that's July over July. Pretty close, but you can also see that we've had some months where with very high observation cases, we've topped 400. And what you can also see is while the total numbers are pretty much the same, July over July, the different spread where last July it was 65 observation cases and this July it was 103 observation cases. So definitely showing that trend to more observation cases, it has been pretty consistent. Next slide. Here's what we're doing on deliveries. This year we've definitely had some months with lower deliveries. July was better than June. We had 59 deliveries, but again, that tends to be running, about 10 or 12 deliveries below what we kind of historically were averaging. Next slide. Here's average daily census. We had 31.3 for the month. So the last 2 months have been a little bit unusual for us compared to this time last year. And even August it's improved, but it's really still only at about 32.5 or so. And so you can see it's going to come in lower than where last month came in, or last year, August came in. Length of stay, we continue to, just hover right around our budget of 3.8. And usually it only takes one or two cases to sometimes miss that by a little bit, and we missed it by just a fraction in July. But on a year-to-date basis, we're sitting at about 3.75 and still well within our budget. Next slide. Here's a look at acuity, and here we've the last few months we've had a little bit higher acuity. Last month dipped back down, but we've had 2 of the last 3 months at an acuity of 1.6, just showing that some of our patients are coming in with some higher diagnoses that drive up the case mix. Next slide. Outpatient visits per day. This is the ER and non-ER, the ER being the lower section. So this month we actually did see a little bit lower ER volume, just averaging about 90 patients a day, which is still a very busy day for them in the ER. And then on the outpatient side, starting to pick up a little bit where we had fallen off last month, almost 103 outpatient visits per day. Next slide. From a surgical perspective, this follows very similar to the inpatient observation slide, where we're doing less inpatient surgeries, again, because of better recognition that these really should be done as outpatient surgeries, and they were not cases that required an admission. So for the second month in a row, we were in the low 40s with 41 inpatient. We did get a nice boost back up on the outpatient side with 136. So really the third highest month of the year, the first 2 being January and February, and then we had seen a drop off. So it was nice to see that in July. And we also bounced back up on the robot assisted cases with 22 this month. So back up there in the 20s, which is where we like to be. Next slide. From a payer mix standpoint, a decent month payer mix wise. First number I always go look at is the commercial, which is the top blue section. We were at 15.8% on the inpatient side. That's about a 1.5% improvement over last month, which was an improvement over the month before. Not our highest, and not even as high as last year at this time. But definitely always looking for every commercial patient that we can get here as their reimbursement is stronger and help subsidize some of the other payers, the government payers. We did see, probably the biggest decline is actually in that purple section, which is our alliance business. It's still very strong at almost 38%, but we've had months, as you can see, that we're up in like 45, 44, 40, close to 45%. And the other probably good news here is that the next highest is that blue at the bottom, which is the fee-for-service Medicare, and that was at 35%. Next slide. Here's your outpatient mix. Commercial, the blue at the top, stayed, pretty flat to last month, just a slight decline, but still 24.6% is good and strong for us. And you can see we've had, 3 of the last 4 months over 24%, and that is strong. Again, the decline came a little bit on the alliance, but still strong at 43.6%. And very similar to the inpatient, we can see that the outpatient Medicare jumped up almost 3% there. So, generally I look at this and I say payer mix is pretty consistent, and that's, generally a good thing for us. Next slide. Okay, that's where I thought we would land, is at the questions. So I'm happy to take any questions.
Julie, does reimbursement for observation admissions and outpatient surgeries, this is pretty favorable?
No. Observation it is not, its observation is basically an outpatient status, so it pays at much lower rates than if it was an inpatient admission. But if it doesn't qualify as an inpatient
Understood,
admission,
yeah,
they're not
yeah.
gonna pay us. So,
No, understood.
yeah, yeah,
Thank you.
great question though.
Any other questions before I open the next public comment? Seeing none, I'll go ahead and open up the public comment portion for this item. Rosie, any raised hands online?
No hands raised online.
Anyone wishing to speak on this item? Person, seeing no raised hands, I'll bring it back. And if there's no other comments from the board, I'll move on to item number 10. No, seeing none, I'll move on to item number 10.
All right, item number 10 is bylaws, so good times. So the recommendation here is to pass a motion approving proposed hospital corporation bylaw changes. Consistent with regulatory and industry standards, we need to do this at least every 2 years. The hospital bylaw changes and updates this time around are a lot of formatting changes. And again, you saw most or all of these last month for review. This month we're asking for approval with any recommended changes you might have. A lot of clarity added to Article 4 regarding how we take actions on policies, regarding language around interested board members, the organizational meeting that we have each year, policy and procedure compliance, and how we define a quorum. We added clarity to section 5.2 as to when new officers take office, and 5.4 regarding vacancies. Added some language around alternates, and a number of changes to and clarifications, simplifications to the membership for all our committees. In 6.5, updated the name of the finance committee, updated and simplified the duties of the quality and patient safety committee, added some clarity about the ad hoc. So happy to entertain any questions. Rosie will hopefully be able to help me answer some of those as well. She's done a ton of work on this. Thank you, Rosie, for all of the track changes work that you've done with all of the different people having input. So we can take questions, comments, and or motion to approve the changes.
Any comments for Steve before I open up to public comment? Questions as well? Okay, I'll open up for public comment on this item. Seeing no raised hands, I'll open up for public comment.
In regard to the policies that you have in here, so it's something that has come to our community that I don't know if you have a policy in regard to treatment the elderly when they go to the ER. If you don't, I'm not aware of it, or the community is not aware of it. Because what I have seen in the past is that you have a patient in the ER and it's elderly, they wait so many hours in there. And sometimes, you know, the pain and suffering that they have in the ER is not really not commendable in a sense of providing that service. So my question will be is that maybe in the future, you could be able to look at your policies regarding how you treat the elderly when they go to the ER. Because eventually, when you see a patient who is 90 years old or 80 years old, yet waiting to be treated is very painful for the family and to the person that they need that help. So I don't know that to happen. We are right now in the process to go into legislation regarding this matter. And hopefully we can be able to come out with a solution in regard so all hospitals can be able to have a policy to how they treat the elderly, especially in the ER. So that will be my suggestion, that if you don't have it, hopefully you can be able to come up with some stuff, a policy in regard to the elderly.
Thank you. Any other comments from? Seeing none, I'll bring it back to the board for any final questions or comments, and I'll entertain a motion as well. Please.
I would like to make a motion. I would like to
continue this item to the next regular meeting in order to have an opportunity to get feedback from MEC, who was not able to get us feedback by this meeting, but would have opportunity to give us feedback in time for next.
Second,
Okay, Rosie?
Director Gallagher,
yes?
Director Fontaine,
Yes,
Chair Negus,
Yes.
and Director Gallagher. No, sorry, that was it, Fontaine Gallagher, correct?
Okay, we'll move on to item number 11. That's the Potter Valley Healthcare District Hospital Corporation Strategic Planning and Marketing Committee update. Steve?
Yeah, I can do a little,
Yeah.
summary and then to the committee that you're on. So the board has put together the strategic planning and marketing committee and we have defined the cadence of meetings as needed, typically between July and October, in order to be able to do some planning for the following year. So the committee has met so far 2 times, on July 16th and August 13th. And the work to date has been around the description of the committee and the bylaws, the membership, as well as discussing a strategic role, including a plan to establish criteria for evaluating new services and how the committee might provide input on high priority strategies that could be incorporated into the next year's strategic marketing plan. So we will, I think we have another meeting coming up in September to continue that work, but I'd love to hear from Chair Nunez and Director Gallagher on insights they have from that committee.
So just to piggyback off of Steve's comments, so I was named I believe it's the chair, is the title of that committee as well too. And so some great meetings to set up what will be the backbone of this committee, and I'm sure Dr. Gallagher as well too will attest to this, is we really want to continue to have staff be a part of this committee and to extend that invitation out to interested staff members and members of our medical our medical staff as well. And also have it be a part of our community outreach as well too, of bringing in some community members. And so we've gone over the committee description, as Steve has said, with the community in mind. And we had a really great discussion coming up with, at the time, 5 criteria for evaluating what new services might look like, and how we evaluate that as that committee going forward. And so, as Steve said, we have an upcoming meeting in next month. Great work going on there, but really, I would say the beginnings still of setting up that committee for success. And I think the old saying is you got to show up to be able to have to make decisions, and that's along with trying to balance community input, staff input, is also trying to make the description so that we can continue to have these meetings and have quorum to vote on things. So that's been the balance for us so far in our first 2 meetings. But Joe, anything else you want to add on to that?
The only thing I'd add is, I think the thinking together part of these meetings has been sort of extraordinary.
Yeah.
In terms of a whole bunch of it. So it's been pretty productive and useful, and another opportunity to all work together.
So more to come from that, including an opportunity for staff to volunteer to be a part of this. And we'd love to see folks join us and help us determine some of these really key policies going forward. If there's no other comments, I'll close down the hospital corporation agenda and move on to the district. So I'll adjourn that meeting, and